All right. Hey guys, I just want to follow up on a blog post that I posted, which was on the hip hinge breakdown. So I was discussing about the hip hinge and how important it is in order to not have low back pain with regular activities as well as your lifting exercises. So with this particular video, I just want to discuss some of the things that you need, such as like a hip hinge checklist, in order to perform it correctly. So I want to start with the head and work my way down. So the first thing I think you need to have is a certain amount of cervical flexion. So a lot of times when we're standing, our head is protruding forward. You first need to be able to kind of maintain a neutral cervical spine. And then on top of that, I think what you need going further down, you're going to need it to be able to maintain a shoulder blade squeeze throughout the movement. And then on top of that, I think you need to be able to draw in your core and maintain a neutral low back. Because if you have any extension here or any roundedness, then it'll place more stress on your back when you're doing the hip hinge. And then on top of that, the next thing I think you're going to need will be able to touch your toes in a comfortable manner so that you don't feel any restriction or strain. Usually whenever you touch your toes, if you're tight or there's some type of restriction from your hamstrings, it kind of feels like it won't give here, or you get to that motion or that or to your toes by rounding your back. So it should be something simple and easy so that it doesn't feel like you have your brakes on when you're trying to do that movement. So to put it all together, what you're going to need is just some cue. When you first start out trying to do the hip hinge correctly, you're going to need a cue, okay? And I just like to always use a PVC pipe, or you can use a broomstick. But you're going to have 3 points of contact. One right behind the head, okay, so the cervical flexion. One between the shoulder blades, so you're going to bend your shoulder blades, and one touching the glutes. And so your 3 points of contact should be touching at all times. So right here, as you can see, I have like an arch in my back. Make sure you draw that stomach in and maintain that correctly. And then your hips, your feet are going to be hip width apart. And from there, as you hinge from the pelvis and not round your back, you should keep all 3 points of contact the entire way. So it will look like this, a correct hip hinge. Some compensations that I normally see are these. So make sure you keep your 3 points of contact at all times. Practice this movement, and as you do it more often, it'll become more fluid, and it'll save you from having low back pain with lifting, as well as just with normal activities that you may be doing around the house. Seek solutions. Take care.